So thank you all so much for coming tonight. We are here just with Jackie Rue, and she's going to introduce herself in a second, but we want to introduce ourselves as well. My name is Lindsay Kirby. I'm one of the program chairs in special education. It's really wonderful that you're all here tonight. Thank you for coming.
Good evening, everyone. I'm Claudia Holland. I'm one of the social workers at Oak Park. Welcome.
And I am Beth Wanglin. I'm a special education teacher at the high school. And some things about Jackie Rue, which I'm not sure if everyone was able to get the flyer or not. Jackie is the co-founder of the Center for Emotional Wellness of the Northwest Suburbs and is recognized as an expert in her field. She's also the co-host of the Successful Parenting podcast and the co-author of the Successful Parenting Workbook. Jackie's a clinical consultant for Amita Health, Alexian Brothers Behavioral Health Hospital for the past 10 years. She also served as the assistant director of the Alexian Brothers Behavioral Health School Anxiety and School Refusal program, where she was instrumental in the creation and development and the success of the program. So without further ado, Jackie Rue.
Hello, everyone. I am excited to talk about this topic tonight. This is one of my favorite topics. I started the school anxiety program at Amita. I am no longer there. I consult with multiple school districts in Illinois, partnering with schools and parents on helping their children gain engagement, gain resiliency skills, as well as attend school, as well as thrive in school. And so I'm excited to share different information with you tonight. There's no, magic answer. I think most of us on here tonight are parents or we're family members. And so one thing I always share is that our kids are going to struggle. And just because they're struggling today, that is not an indicator of how successful they're going to be tomorrow. It's really about how we come alongside them when they are struggling. And so keep in mind tonight, as I'm sharing different tips, take what's helpful for you and leave the rest. There is no perfect scenario. And so I might share some ideas and you might think, okay, that does not fit with my family. And I may share some things that you're like, wow, this is really worth thinking about. And so this really tonight is about some discussion. I've worked with thousands and thousands of families that struggle with school anxiety, school avoidant behaviors. And so, when we share these things, a lot of it is what's worked for the families I've worked with. Originally, I am going to share when I first started the school refusal program at Amita Health. And back then there was one program, two programs, actually. There was two programs. It was the second program. It was, I think, Northwest Community and then Amita. And since that time, there has been multiple programs all over that have popped up, very similar to the one that we had started. And so when we first named it the school refusal program, one thing I noticed is families would call me routinely and say, I don't think this fits for my child. My child is a really good kid. They're really bright. They're not a school refuser. They're not a truant. My child is struggling. And so we heard families, and what we did is pretty soon after we changed the name of the program to school anxiety, school avoidance. And I'm going to explain a little bit more about that. So when you hear school refusal, it isn't about kids that are not good kids or kids that are bad kids or even behavior issues. It's really about when we become anxious, when we become overwhelmed, sometimes we engage in avoidant behavior, which is refusal because we believe our children have a choice whether or not to attend school. And again, we're going to go more into that. I'm going to encourage you to use the chat tonight to ask questions, to make comments. There are two features on the chat. You can chat directly to me, and so I can see the question. No one else will see it. Or you could chat to everyone, so then everybody on here will be able to see it as well. I like to share just a little bit about me so that you know where I'm coming from. I am a parent of two girls. They are both adults now. One, my oldest daughter is almost 25. She is a school social worker for CPS. And my younger daughter is 24 almost, and she is a computer science engineer in DC. I have 2 daughters a year apart, totally different. My girls struggled at different points. I taught them many great things, but the funniest thing of all is I'm not sure if they listened to much of what I said, but they act just like me. So we're going to talk about how our own reactions sometimes can really be one of the best teaching tools we have for our children. Like, Beth said, I, founded the Center for Emotional Wellness with Kathy Berger, and we have 30 therapists now in a few different locations. I speak to many school districts on this topic, both to staff and parents. I have about 2 to 3 presentations a week, again, on different topics, but this is truly what I love to do. We have a parenting podcast. And if anyone else adopted a dog during COVID, I did, and she is on the top right. She is our pretty much our only child right now. And bottom is what I like to do, just to get outside, either walk or run, to engage in some type of self-care. As parents, as caretakers, I believe it is super important that we're aware of what's going on with us emotionally. Many of us are stressed. We're dealing with our own trauma. We're dealing with our own emotions. And so one thing I like to check in, whether I'm talking to students or faculty or parents, is, where do you feel like you are today in terms of how you're feeling? Feel free to put it in the chat. Many of you might be like, oh my God, I'm a number 4. I can barely keep my head up. I am drowning in all the stuff going on in my family. Some of you may be a 9 and you are just breezing through parenthood and you're like, this is a piece of cake. I am so great. I should be teaching other parents. You might even be a 5. Okay, we got a 4, we got a 4 and a 5. We got a 1. I would say, I think I think yesterday I was a little bit of a 4. Oh, we got an 8. 8's good. There's a 3. One of the things I love about this too is I spend a lot of time talking to high schoolers and middle schoolers and elementary kids about there's not a good or bad feeling. Feelings are just feelings, and we want our children to be able to tolerate and experience them all. And some parents will say to me, when their children look anything other than happy, their radars go up and they have a tendency to say, what's wrong? Are you okay? And want to take those feelings away. But one of the things when we're in terms of, raising a resilient young adult, we really want to encourage and even allow our children the space to feel. But it's going to start with being aware of what's going on for us. So that's going to be key. And I'm going to show you how this is going to tie in the morning. If you do have a child that struggles to get to school and you recognize you are really frustrated and you're getting really upset and you're getting really angry, you might want to lean in and start screaming, yelling, power struggling, crying, pleading, talking with your child. None of which is probably going to be really productive. And so one thing I would do when I was parenting, and this was a little bit ago, but I would try to recognize where I was in terms of how I was feeling. And if I was feeling really heated or out of control, I would walk away for a minute. And I laugh, because the definition of insanity is doing the same thing every day, hoping for a different result and saying nothing's working. But I think sometimes just by shifting and doing something differently, it can make a big difference if we're consistent. So think about where you are. And if you are number 4 or you're number 5, it just is what it is. And think about supports and things that you can do for yourself. And that might mean taking a step back. That might mean maybe, you're not dealing with something in the moment, because we're not going to fix everything today, but it might mean focusing on yourself for 1 or 2 days and then kind of getting a game plan before going in. Please, I'm going to ask you to use the chat again. This is going to be helpful as we go through and talk about some other things. When I meet with a child in my clinic that has anxiety or school refusal, I start by asking the child, and sometimes I'll make a list and have them circle, what are all the situations that are uncomfortable for you, whether it's in school or out of school? Because a lot of what I see is it's not always just about school. It's about just functioning in general. And so what are some situations that cause your child to be uncomfortable? And that could be, being criticized, being judged, being made fun of, failure, giving a presentation, okay, cold weather, large groups. And I think it's important to kind of tap into what those situations are: gym, locker room, walking around alone to school. And these are great ones. And pretty much everyone is going to have some things to go on that list, and really tapping into what those situations are that cause your children to be uncomfortable. Failure, fear of making mistakes. For some students, it's they perceive a teacher might not like them. They perceive that something is going to happen. They're perceived they're not going to be successful. How do you typically respond when your child is experiencing medical or emotional concerns? And thank you for putting the attention on them, because I hear that one a lot. Just that fear of being identified, or fear of being having attention on them. How do you as a parent typically respond when your child is experiencing medical or emotional concerns? And sometimes there's going to be some overlap, right? Sometimes, physical symptoms can exasperate emotional, and emotional can exasperate physical. Panic. Some parents will say, I had a mom tell me the other day that she feels really sorry for her child because the child's dad are divorced. And so she said, I feel so guilty. I feel so sorry. My child is dealing with all these things, temptation to fix things. And so tapping into kind of what your why is and how you respond when your child is emotionally or physically not doing well. So if I might have a child that has medical issues, and I might feel really sorry for them when they're not feeling well. And so I'm quick to maybe parent different when they're not feeling well. I might you'd be quick to like kind of fluff their pillow, bring them food home, kind of watch movies with them. And those aren't bad things, but what we want to do is we just want to see what kind of patterns are emerging and what kind of things are being reinforced. Typically, kiddos with emotional or medical concerns do better with structure and routine. That actually helps them thrive and be able to work through it a little bit. Do you reinforce avoidant behavior? So if your child is struggling, do you have the expectations that you normally would have, or do you have a tendency to lower the expectations? So maybe you have a child that is really sad and they're not hanging out with friends, but they like their video games. And so they play a lot of video games, maybe more than you would like, but you're worried if you set boundaries on the video games or the phone, that they're going to become further depressed, possibly even have some scary thoughts or possibly rage. Do you normally take a step back and do something different, or do you maintain those expectations? And these are not easy topics. And so when you're making notes, try to just start to think about things from a non-judgmental perspective. Try not to, this is just really about kind of awareness. And so I love that, you said that you're worried, your child's alone. So it's important that it is reinforcing avoidant behaviors, and it's really easy to do. I know my younger daughter has anxiety, and when she was in middle school, I had to really catch myself because I had a tendency that every time she looked really sad, and she was kind of a frail, smaller child anyway, I had a tendency to really want to make her feel better and want to reassure her. But what happened is I started noticing that this dynamic that when I came, she almost shifted and started looking more sad. And I caught myself that I was really basically sending a message to her that it wasn't okay to not be okay. And that if anytime she was not okay, I had to rush in and I had to reassure and I had to make her feel better. And I was telling her that, I'm worried, so it must be really bad. And I was also placing this expectation on her that she was supposed to be happy all the time. And that's not realistic. And a lot of children feel like they're failures if they can't achieve that. This one is interesting because think about if you think about your child, or maybe you have multiple children in the house, think about a few words you would use to describe each child. If you have like 2 or 3 children in your home, you might view the oldest as more resilient, as strong, and you tend to kind of kind of just give a lot to that older child, and maybe you have a younger child in the home that you view as more shy, more anxious. It's interesting when we start to label our children or perceive certain things about them. So often we react based on how we see them, right? And so if I see my child is really anxious and fragile and lonely, my reactions might come out of that. One way to kind of start to shift is think about, what are my goals for my child? Do I want my child to be more confident? I want my child to have a greater sense of self-worth. And so what I'm going to do, instead of rushing in every time, I might shift and really start to praise them when they bounce back. I might really start to reinforce expectations, and really, instead of saying things like what's wrong or rushing in, I might really start to shift my responses. That's just an example. And again, these are just a few things to think about. Since the pandemic and before, I think when I started, I've been working with schools for, honestly, since probably about 28 years in different capacities. And so a lot of what's on here, we've seen for a while. There has been an uptick. I think anxiety, we have a tendency to overuse that word a little bit today. And I think it doesn't always do a service for our kids. There is a lot of children and adults that meet criteria for the diagnosis of generalized anxiety disorder, obsessive compulsive disorder, and different types of anxieties. But I also think sometimes I've caught myself overusing the word anxiety when I'm talking to kids. I try to replace it with, what are situations that cause you discomfort? What are situations that are challenging for you? Because I think sometimes we overuse the word anxiety, and it can send a message, well, if I'm anxious, then I can't do it, versus this might be really uncomfortable for me. How do I start to tolerate that discomfort and start to work through it? If you have any concerns about any of these, seek some support at school, your pediatrician, or talking to a private therapist. There are a lot of resources out there now. I always encourage parents, if they are concerned about their child, rather than starting the child in therapy, it might be good to go meet with someone yourself to kind of get a feel for kind of their like methods, get a feel for strategies you can be using at home. I hear a lot of cases where children are in therapy with some of these issues and behaviors, and the parents aren't involved. And to me, I think that can do a disservice. I think as parents, we really need to be educated on how to best provide services at home for our children. So these are some of the things we're seeing. Technology addiction is huge right now. It was huge before COVID. I get this call multiple times a week where parents will say to me, I try to set a limit around tech and they rage, or I'm concerned that they're making suicidal statements. I'm concerned that they're going to be further depressed. This is one of the challenges we're facing now, and I will try to touch on that a little bit. And definitely some of these will talk about, some of these can lead to not going to school, and some of these can lead to obviously not functioning. The longer it goes on, the more difficult it can be. And so I'll provide some tips on that. And many of the students I've worked with students that have missed some days, some classes, and I've missed students that have been out for a long, long, long time. And so that is huge. And then Beth, if I'm not answering any questions, if you kind of want to keep track so we can answer them at the end, because there are quite a few coming in, and if you can help me with that, that would be awesome. Beth has heard me talk about this. And when I was first in the program, and I think it was, I used to, before the school anxiety program, I oversaw a self-injury program and eating disorders. And I remember when I was talking to families, parents were really, really concerned. And they were like, I just don't understand. My child's such a good kid. My child's really smart. I don't understand why my child's struggling. And so one of the things we did is I, along with one of my colleagues on the program, we created this emotional development scale, which was really a tool that was based on different research. And so one of the things that I quickly learned to do, And I've never been a therapist that looks at a child as broken, or I never have a case that I feel like I'm hopeless about. I really look at where children are in terms of development, right? So I look at where a child is physically. Like I might have a child that's 12 that looks 16. I might have a child that's 14 that looks 8. You know, when you think about physical development, that's important because so often others will respond to that child in terms of how they look physically. I think about where the child is in terms of emotional development. So I work with a lot of kids too that are really, really bright and even gifted. You know, those kids might be really, really high in different categories, intelligence wise, but emotionally, where are they in terms of their emotional development? So I have a kid who's 14, he looks 15, really, really high test scores. The child does really well in certain learning skills, but emotionally, this child has a hard time maybe regulating emotions, has a hard time advocating for self, has a hard time problem solving. So then we start to look at, okay, you have a child here physically, emotional development is here. I look a little bit at language too. How does the child process information and how does the child express, right? And so when I sit down with parents, we start to look at, okay, these are the gaps and we need to come in and we need to start to close these gaps. So it's not about the child being good or bad. It's about where is the child in terms of physical and emotional development. This can tie in to forming expectations. If you have a child that really struggles with perspective taking and they're seeing things from their perspective, but you think they're lying, you might get really frustrated and start fighting with them because you feel like they're not telling you the truth, but maybe it's coming from their perspective, if that makes sense. So this is something that we use, and it's not, you know, kids with depression, kids with anxiety, all these, you know, autism even, it's going to impact where they are emotionally, but it's still going to be a good tool to start thinking about what skills that you want your child to have. So I think so often we forget, you know, maybe my child doesn't know how to advocate, or maybe my child hasn't learned the skill to ask for help. Maybe they just haven't. Maybe I recognize because I have my own anxiety, I jump in every time and they really haven't had to. Maybe I recognize my child really struggles tolerating discomfort. Maybe it was the pandemic. Maybe it was something else. Maybe it's just where the child's at, honestly, because kids develop at all different rates at all different times. And, you know, you might have a child that has ADHD, he's 15, but emotionally he may still be like 11 or 12. With the pandemic, we did see some gaps. And so we're seeing in some a 2-year delay emotionally. Again, it's not necessarily good or bad, it just is. And so what we do is we start to look at, okay, how can we support the child where they're at? And how can we work with them to gain those skills? This is the emotional development scale, and I know it's super hard to read, so I apologize. And I am guessing probably most of you will have a hard time reading it because the font is like ridiculously small. But this is just an example of one of the tools I use. And so I'm actually we're working on a revised one for children and athletes too, and working with coaches on that. If you think about, you know, where your child is. So for instance, you might have a 15-year-old and then you look at, okay, age 12 starts to develop the critical thinking skills and recognition of more than the obvious answer, increase in empathy skills and understanding that others may have mixed feelings, you know, concerned with peer opinions and fitting in, but should be able to handle limits and calm self when upset. Okay, so you have a 16-year-old and you're like, wow, okay, my child is really struggling with that one. So we need to kind of work on those skills. Maybe you're like, wow, you know, we recognize that we might even in some situations be at age 4 and 6. If there's been trauma, sometimes it can halt it even more, different things. Try not to read into it too much, but it can help to start to get a framework for some of the skills that the child might need. One of the things, hands down from a clinical perspective, if your child is working with a therapist, whether it's, you know, through your parenting, just thinking about, you know, really helping your child be able to problem solve. We want our kids to be able to kind of be in front of a situation and learn how to navigate and problem solve. We want all of our children to be able to ask for help. Obviously, we want them to have one trusted adult in school, but you know, sometimes kids have a really hard time connecting and building those relationships. They may think no one likes them. They may, because they struggle to school and they may not be there every day, it's harder and harder to have those relationships. And also tolerating discomfort. You know, we always joke, we teach people to be comfortable being uncomfortable. We teach them how to sit with discomfort. We don't want to interrupt it. We don't want to make them feel better. You know, true anxiety work is done by allowing children to sit with discomfort and in small increments and tolerate it over time. So if I have a child that's scared to order food in a restaurant, or scared to answer a question in class, I might practice with them, have them sit with those feelings for 1 or 2 minutes. And sometimes I use like a little timer, and then we gradually increase the time, having them recognize they are going to be uncomfortable. And I always say to kids, this may be really hard for you, but I have confidence you can manage. And I want you to do things that are difficult for you every day versus I know you're going to be great and you're a superstar and everything's amazing. I might even say like, you know, your teachers may not like you, you know, you don't go to school that much, you really don't turn your homework in, but how can you kind of navigate that? And so sometimes being real with them, and they may cry and get upset especially if you haven't done it before. And as a parent, sometimes tolerating that and not reacting just based on their response, but kind of going back to your purpose. So we're just going to briefly go over school anxiety, refusal, and avoidance. I'm going to share a few things just so you kind of see where we're coming from just in terms of research. And then we're going to go into some strategies. I'm not going to spend too much time on some of this. I do just want you, when we look at it from a clinical perspective, when we think about school anxiety, avoidance, refusal, we look at students that have missed a lot of days of school. And it doesn't really always matter if they're excused or unexcused. We're just looking at absences from a clinical perspective. We look at, I have a lot of students that go to school, but then they don't go to class. So they might hide out in the nurse's office, the bathroom, different places within the school. Sometimes gym can be a really challenging class, or those classes that can be a little bit more unstructured for a child that has performance anxiety or social anxiety. Also have children that have a lot of like headaches and stomach aches. I have children that have medical diagnoses. They have migraines, they have POTS, they have, you know, different things like that. And so we talk about maybe when they're feeling stressed that some of those physical symptoms may even be increasing. When there's also a pre and post assessment that we have used, and this is just, I'm just noting this, so this is not something that you have to use, but Chris Kearney is someone that I've read his research. This is a little bit dated, but I like it because it breaks down school refusal into 4 domains. And when you do the pre-assessment or you do the assessment, you'll score, typically a parent will fill out the assessment and a student, and you're going to score differently. So you might have a score in each section, but it'll be more dominant in one and maybe even 2. So the first grouping of kids, they may avoid school because they feel sick when they're on their way to go. They might feel more sad. They might feel more anxious when they're there. Typically for kids in domain 1, Mondays are challenging. You know, any day after there's been a break, you know, these kids really do better with a routine. And so those kids typically avoid school because of the way they will perceive that they'll feel when they're at school. And a lot of times once they're in the door, they generally do okay. I always caution parents not to text them when they're at school, and I will explain why. It's actually going to heighten their emotional responses and make it more difficult for them. Escape from evaluative or social situations. These are children that may have OCD, obsessive compulsive behaviors, perfectionism, social anxiety. Sometimes even kids on the autism spectrum may fit in here. These are students that anytime there's a chance for failure, they're worried about being judged. They're worried about being criticized, you know, can be very rigid in thinking it's either great or terrible. And, you know, you might have a child that comes home and you're like, how was the day? It was terrible. It was awful. And I always encourage parents to recognize that there's a lot of things that happen in a day. So if your child is like that, really prompt them to say, what's one thing that went well today? And what's one thing that was challenging? Because you can get them to see there were many things that happened. And then you can discuss how they managed through that one thing that was challenging. Domain 3, separation anxiety, doesn't want to leave home. Maybe there was something traumatic in the home. There's a lot going on with the family. Maybe there's, situations going on, just having a really hard time leaving home. And then there's domain 4. There's something I'd rather be doing when I'm at home. So I would rather be gaming. Maybe I'd rather be out with friends. Maybe I would rather be sleeping in till 12. But, those different things that have maybe been reinforced. So maybe you started with domain 1 and you had like medical issues or physical issues, but you grew into patterns of avoidance. You became really reliant on electronics. Your sleep was off. And then you quickly went into a section domain 4. So you can think a little bit if you have a child that struggles with this, like which domain they would be in. And then when we kind of score that, and often the parent and the child will have different ideas, but often it's very similar. So we can kind of talk about what's going on. If you have any questions, let me know. I know I'm throwing a lot at you. If you yourself want to make any comments too, and again, you can make them directly to me or just in the chat. I treat a lot of cases of anxiety. Anxiety is actually one of the easiest diagnoses to treat, thankfully, because we're seeing it a lot. We treat it from a behavioral perspective. A lot of times when we're dealing with anxiety or stress, and they're a little different, stress is when we're overloaded, overwhelmed, our expectations are not quite in line with reality. We're placing a lot of pressure on ourselves, where anxiety can be the fear of something occurring. It can be just feeling that these thoughts. I always joke, anxious people don't get up and worry they're going to win the lottery, right? Anxious people don't sit around and worry that everything's going to go great. Typically, you start to catastrophize. So from a treatment standpoint, we help students recognize those things that cause them to be uncomfortable. We teach them to sit through that discomfort, healthy levels of stress versus, what their expectations may be of themselves, looking at the difference between success and perfection. And honestly, I ask a lot of students, do you think that you're going to be successful in our buildings? And when they say no, we start there, because oftentimes that gives me a hint that might have something to do with their expectations and what they're feeling. So again, when we're in that anxious state, we don't want to take away expectations. We want to have some structure. And so I used to laugh because I was at a meeting once and, the child was anxious about, raising their hand in class. And so they said, okay, well, the child said, I'll come to school if I never have to raise my hand. And so they said, okay, you don't ever have to raise your hand. Well, the child was still anxious, because then the child became even more anxious, because now the child's like, wow, if they don't think I can raise my hand, and then if I can't raise my hand, then maybe I can't even walk into a classroom. And it just kind of grew. And so we don't want to take away things that make the child anxious. We want to teach the child how to manage anxiety doing those things, but it is going to be a process. We just need to have a plan. When we're in that emotional state, we're going to have thought distortions. We're going to think things like, I should have done something different. This is terrible. This is awful. You might be overly emotional. You might have physical symptoms. So when you're parenting and your child is struggling, there's a good chance as a parent, you're going to be really anxious and heightened. And so just recognize your own anxiety and kind of get a handle on that. What we want to do is when we're parenting and our children start to escalate, we want to co-regulate with them. So we want to kind of come alongside them and stay as calm as we can when they're heightened, which is hard. This is, believe me, I made many mistakes. I've yelled at my kids when they were younger. I've done everything wrong. And so I'm not sitting here saying that this is easy, but I'll laugh. Have you ever yelled at your child and thought like, wow, that really worked? Probably not, right? So we talk about getting aware of our own anxiety, staying calm, and then kind of regulating with them. If they start to get heightened and you get heightened, it's just going to make a big to-do, and it's not going to be real successful. There's some kids that will follow you around. They'll batter you. They'll text you. They're nonstop. And so it can be challenging. This is an example of, and you're going to have this recording, and so we're going to have it too. And so this is just an example of a list I made of situations in my clinic for a student that they circled, and I just said, circle all the situations that cause you to be uncomfortable, and I will change the list for the student. And so it's helpful for them to get a handle on what are things that are challenging for them, and then we can start to work with that. If we don't have expectations in place, and I'm going to talk about that in a little bit, it's going to be hard to do this work. So if we don't have some of that structure at home, it's going to be challenging to do this. So this is going to be after we have that structure in place. This is something else that is interesting, and you can read more about this, but it's the family accommodation scale. And so if you have a child that has anxiety and you're like, okay, well, I want to look at this. How often did you reassure your child in the past month? Meaning you'll be fine. Don't worry about it. Maybe you said you felt like you really had to pump them up. Maybe you have a child that you're constantly having to tell them it's going to be okay. Think about that reassurance, because with anxiety, reassurance and avoidance are actually going to hinder the child and make it worse. The problem is most of us parents do the opposite, which I know I did until I had to really learn to kind of shift things. So even how often did you provide items needed because of anxiety? Maybe you had to make special arrangements. How often, did you participate in behaviors related to your child's anxiety? How often did your schedule change for your child's? So these are just some things. I'm not going to read through all of them, but there's research and data out there if this is something that would be helpful for you. And I love the one, have you modified your family routine because of your child's symptoms? I think most of us would probably say yes. And you can start to pinpoint what areas you as a parent may want to work on if it is a child that has anxiety. They have one for OCD too, and they have one for some different things too that you can find, and you can pull them free on the internet. A lot of times we use cognitive behavioral therapy with different therapies when we're treating children. So if you have a child that's got school refusal or anxiety, you want to make sure they're with a therapist that uses, maybe CBT, as well as if it's anxiety or OCD, exposure response prevention. Typically, these children don't do well with just talk therapy. I use this too with children, and I will switch the word anxiety. I might use anxiety, anger. I might use sadness, depression, whatever the child labels kind of how they're feeling. And I help them, recognize their physical symptoms when they're feeling, a little bit nervous or a little bit angry. And then we look at all the way up, as well as thoughts and coping strategies. Coping strategies you have to practice every day for a couple minutes. They take time to use. And so when I'm working with schools, oftentimes, we set an expectation that the child has coping skills, but they have to use them in the classroom for so many minutes before they can leave. Because if you say, okay, leave the class every time you're anxious, it's going to just reinforce that avoidant behavior. This is one, and you don't have to use it on a paper. I love using with kids that are in that domain too, very concrete thinkers that will tell me it was a terrible day. I will literally have them write down one piece of evidence that happened during each hour of the day at school. Maybe it was I sat with somebody, maybe it was I sat alone, maybe it was I took a math test, maybe it was no one talked to me, whatever their piece of evidence is. And then I have them say, how was your day? And typically they'll say, okay, it wasn't that bad. But what happens is when they start to catastrophize and they say it was terrible and awful, and as the parent, we might then start to catastrophize too. This is one of my favorites too. And I would just ask, what is your hot button as a parent? And you can even put that in the chat. What is your button that will cause you to yell, that will cause you to scream, that will cause you to react to your child? What is your button that you feel like causes you to feel sorry for your child, causes you just to really pull at your heartstrings? Be aware of what your buttons are. Some parents will tell me it can be guilt, frustration. I've been doing this for 5 years and I'm done. I can't do this anymore. Sometimes as parents, when he says no, definitely when the child says no, or when the child refuses, Guilt. Yep. Guilt. And guilt is a big one, I think. And guilt is common as parents. I think recognizing that it is guilt is the first step, and then recognizing kind of what is purposeful versus kind of what is more our emotional reactivity. I am not comparing your children to dogs in any way, but I was funny when I first adopted the dog during COVID, Nala. She like whimpered a lot and she cried a lot and she was super scared and she had gone through like trauma. She was 8 months old, and me and my husband were like over the top with emotion, hugging her and just all this stuff. And we took her to a dog trainer, and the dog trainer like took one look at us and said, "Your dog is not the problem. Like, you guys need to change what you're doing because you are creating an anxious mess." And what we were doing is every time the dog looked anxious, we were like rushing to the dog's side. We were like reassuring the dog. We were doing all these things that the trainer taught us, that we had to look confident. We had to look like we believed that the dog could handle things. And when we started to change our reaction, the dog started to change. And again, our kids are not dogs, obviously, but when I've actually changed my reactions and my approach, you got to do it consistently. It's going to get worse before it's going to get better. It has helped a ton. So for a lot of our kids that are struggling, and they might be struggling with a whole lot of things based on how they're feeling. And so try not to get caught up in the, think about where your child is, and think about what your goals are for the child. And one is just increasing that self-awareness. Yes, I love that question. Do you have any example scenarios? If the child says this, you say this. I think sometimes, like, and I'm actually going to do this slide and then answer it after, because I think it'll make more sense. Being aware of our emotions and kind of what our hot buttons are. What are our goals? What are our goals for our children? Do you want your child to be more confident, more resilient? Think about where you want your child in 10 years. Do you want your child, what type of adult do you want your child to be in 10 years? Do you want your child to be independent, resilient? How do you want your child to be able to manage? Think about some structure in terms of what are the expectations in your home? What are the expectations for your children across the board? You might have some children that they just go on autopilot and you're fine. And then you have this child that everything is a battle. Structure in terms of if they are really struggling, are there like electronic devices in their room? Are they, what are they doing when they're anxious or not at school? What are their sleep patterns? How is their hygiene? How are they, meeting expectations, spending time with you? Are they respectful? Whatever your goals are for your particular child based off concerns you have, start to think about what your expectations are. And I have a visual about that. Communicating effectively, we're not yelling, we're not power struggling. Ideally, we're going to do it, but ideally, but we are kind of staying firm, even if we start with just one thing. And I've had parents just start with, okay, for the next 2 weeks, I'm just not going to yell. That's all I'm working on. It's okay to start small. And also recognizing obstacles. And so I am going to give, yes, I will answer that question too. So I had one example. I had a mom, and this was a long time ago, and she had a child who was 14, and the child started high school. This child put a lot of pressure on herself, and the child started to feel really ill and sick. And so what happened is mom was working a lot. Mom had her own stress, and she was not very attentive with the child because of stuff she had going on. But then the child got sick and mom was super attentive. They ended up going to doctor's appointments. Long story short, the child missed like 4 months of school for doctor's visits and different things. And she had some real things going on. Finally, the doctor said, you know what, we've tried everything. We want you to go to the school anxiety program and work with Jackie. And so the family came, and it wasn't, we got the child in some structure where she was coming in at 8 to 3, Monday through Friday. And we were working on all kinds of skills and different family dynamics. And mom was frustrated by this point. Mom said to the girl, like, I don't understand why all of a sudden you're doing better when you were home for 3 months and we've been going to all these doctors. In a nutshell, the child said, I like the parent you are when I'm sick. And so that's interesting. And I know that it doesn't necessarily, it's not a simple response, but sometimes we reinforce the avoidance. And so we can talk about this. And I think it's good to have other parents to talk to. I think just keep in mind that as parents, we can be very emotional. And so just making sure that we are looking at our child individually and kind of what is like the evidence-based practice. I've been at a lot of different situations where there's a lot shared that's not always super helpful, and just be mindful of that. The other thing I would say is if you have a child that can't go to school because they are really, really struggling, do you have it where school is, on days that you're not going to school, there are no electronics or video games. And that leads us to the next slide. So this is just an example. We wrote the parenting book, Successful Parenting Workbook, has a lot of this in there. And so this is an example, and you can kind of make this any way you want when you're looking at expectations and privileges. So maybe just think about kind of what your expectations are in your house, and just, are you consistent with those privileges? It's okay if you recognize, like I said earlier, I think the definition of an insanity is doing the same thing and expecting a different result. If you recognize there's a pattern and you're like, this is not healthy, this is not working. For instance, if you have a child that's not going to school, but they're like sleeping in and they're on their electronics, yes, they're depressed. Yes, they have like migraines and all these other things, but you're like, okay, this child's never going to want to go to school if I'm making home more comfortable than school. I need to change this, but I recognize I have not been consistent with expectations. So if I start, this child is, for some of you, the child might be really challenging, right? Most of the kids I work with are extremely bright. They know how to maneuver different situations. It doesn't mean they're bad kids. It doesn't mean they're manipulative. A lot of times teenagers are very savvy, and some of them are more savvy than us. So if you have an expectation, for instance, you have a gamer at home and the child, you say, okay, on days that you're not on time or on days you're not in school, there are no games that day, and you're consistent with that for 2 weeks. Again, it might get worse before it gets better, because if we haven't been consistent, changing something might cause a huge reaction from your child. If you have a child who isolates in the room all the time, I've had some parents say, you know what, there needs to be some family interaction time at night for you to have these devices and things like that. And if you are concerned that your child needs a phone, you can limit what's on the phone too. And again, it's not about punishing the kids. It's about creating an environment of consistency and safety. If you've ever worked for a boss that is very all over the place, and one day the boss is mad at you, one day the boss isn't, the boss kind of most days lets you get away with things, you aren't going to know what to expect, and it's going to most likely cause anxiety for you. And so really, children with mental health issues, trauma, and medical issues, they tend to thrive in structure. Most kids don't come to me and say, Jackie, thank you so much for working with my parents, and now they're limiting my electronics. But most kids will come to me a couple months down the road and say, I'm so happy my parents and I aren't fighting. They're not nagging. I know what to expect. And that's what's helpful. And I even do behavior plans around things like kids sleeping in their bed, even around like bedwetting, even around school refusal. I've created them around eating disorders and self-injury. They're going to look different for each one, but it does go back to, meeting those expectations. And again, eating, even eating, like, here's your nutrition plan. These are the expectations. I'm not going to tell you have to do it. I'm not going to fight with you. I'm not going to power struggle. These are the expectations. If you meet these, which is your choice, these are the kinds of responses or privileges I'm going to provide. I never say to a kid, you have to go to school. I never say to a kid, you have to do anything. Just understand if you're not going to school, this is kind of going to be how we're going to respond. And again, you might not see any results for a little while. You might have to work and you can't be home. There's things you can do for that too. It's just more about being consistent. And so also, if you are concerned for any of these, work with the therapist. Again, I recommend that you work with someone that is also providing you some skills and tools. It should look a little similar to what we're talking about tonight, because this is a lot of what we see. These are just different strategies I use. My favorite is, my favorite two on here are fact versus judgment. I always try to look at the evidence whenever I get really upset or worried. I try to really look at the evidence of the situation, as well as behavior way to feeling better. I visualize how I want the next 30 minutes to go, and I literally just behave my way into that ending. So these are some things. I know we don't have a ton of time. I think, again, we talked about modeling. So we're going to model for our kids, whether it's how we deal with anxiety and adversity, how we deal with our own emotions. It can be a great opportunity to model. I've even said, worked with parents to say to kids, like, I know I have my own anxiety that I'm working on. And because I'm doing things differently, I'm not going to be responding to your text during the day. I am going to be consistent with the video games or the technology on days you're not at school. If you become, worst case, I've had kids punching walls. I've had kids becoming really, really upset. Or the younger kids, we'll have them, like crying hysterically and things like that. It can be so hard as the parent, but again, we're not power struggling. We're not yanking them out of bed, but we are being consistent. And I know someone had asked about treatment options. There's a lot of different options for treatment, and I can touch on that as well when professional help is needed. And this is not an exclusive list by any means. This is just some of the different things that you might see that you might need to reach out for help. So again, this is not isolated. At any time, parents can seek help and just get a plan. There are school anxiety and anxiety programs all over. There really are, like, I can think about 10 in your area. There's also a lot of therapists that specialize in this, as well as even starting with you or, your spouse or a significant other or yourself to work with someone on developing this plan at home. Obviously partner with the school. And you can always follow up and ask me questions. We have a podcast that is, we drop episodes every week. We actually have a pretty well-known guest expert. I think he's coming on this week or next week on OCD, and you can find us there. I can definitely share some. There are patients, there are programs that are inpatient. So there's basically what they call there's therapy, and some of you may know this. So if I'm kind of saying something obvious, I'm sorry, but not everyone does. I think there's individual therapy or parent therapy, family therapy that is usually like once or twice in the week in someone's office. And you can also get referrals from the school as well, or reach out if you need any. And that can be virtual or in person. I always suggest in person, but for some of the parenting work, it can be virtual. Then there's a lot of programs that do what they call like school anxiety programs. So you have Linden Oaks, Amita Health, Ascension. They just rebranded their name again. So it's Amita Ascension. And then you have Compass, you have Rogers, you have SunCloud, you have, there's even more than that have them. And so those are close to your area, close enough. I think closest to you guys is Compass and Rogers. So they have school anxiety programs too. In terms of transport, there are some agencies that do a private transport if you feel like it's an inpatient situation. If you ever feel that your child isn't safe, you feel like you're concerned about them hurting themselves or someone else, a lot of families I advise, call 911, have them assessed at the nearest ER just to make sure they're safe. I hope this was helpful for you all. This is not, again, there's not a one size fits for every family. And so I really hope that, think about what I talked about and feel free to, talk to someone, share with your school. And again, there's not like a one size fits all. This is really about kind of starting to think about where you are and what you need. Thank you, Beth.